Good afternoon, everybody. My name is Dr. Ray, and I'm here to talk to you about what it looks like when health equity hits home. Look, it is the honor of my career to be our hospital's executive leader for diversity, equity, and inclusion, DE&I. Diversity means celebrating our differences. Equity means designing care delivery systems that are unique to each patient and family's needs. Inclusion means building workplace cultures where everyone belongs. These are ideals that we as a hospital can be proud to stand on. And yet, these are also ideals that all too often in today's society are misrepresented, misunderstood, and under attack. That's one of the reasons why I'm so proud of our hospital's commitment to health equity. The idea that every child deserves a fair and just opportunity to be as healthy as possible. In this illustration from the Robert Wood Johnson Foundation, we see an example of the difference between equality, where everyone receives the same bicycle, and equity, where everyone receives the right bicycle. In the upper panel, we see 4 identical bicycles, but only one individual able to utilize it. For one person, they can't even use the bike because they use a wheelchair for mobility. For another individual, the bike is way too small. And for someone else, the bike is way too big. I know there are people in here who work in emergency medicine right now having conniptions about that little kid on that too big bike. In the lower panel, we see equity, where everyone receives the bike that is right-sized for them. For the first individual, they're able to use a bike adapted for their mobility needs. There's a tall bike for the tall person and a small bike for the shorter person. And you know what? That original person and their bike fits just right for them. They don't need a new one. Put simply, equity is not about giving people things for free. Equity is about giving people things that fit. So, often we hear in our society today discussions around equity, and you might not be far off to wonder who cares about it anymore, given the discourse you hear surrounding the term. Who cares about equity? Well, I want to answer that question by introducing you to one of our hospital's most special patients. His name is Liam, and this is the first photograph I ever had of Liam, my son. Now, you don't have to be an expert in ultrasonography to appreciate that this is perhaps the cutest child who ever did walk the face of the earth. In his 2 short years on this planet, my son has already interfaced with our healthcare system in a variety of ways. And at each juncture, he has approached challenges with joy and a level of cuteness that is quite frankly unprecedented, all right? My wife and I are proud of the care that he has received at Nationwide Children's Hospital. It's helped him to learn and grow and play and thrive. 2 months ago, we learned about my son's latest challenge, a diagnosis that is called double aortic arch vascular ring. Now, as a board-certified pediatrician, I am very familiar with this condition. In fact, I have helped care for patients who have this condition. And I know that right here at Nationwide Children's Hospital, with some of the greatest doctors and clinicians in the world, and some of the best and newest technology for caring for kids with pediatric heart conditions, my son should have a great outcome. But as Black parents and Black doctors, as we raise our Black son, My wife and I are also aware of an equally true but frightening reality that my son faces differences in care and outcomes that research shows time and time again is related not to his disease process, not necessarily to our income, but simply because of his race. Now, every single child who receives care at this hospital, regardless of their race or ethnicity, regardless of their gender identity or what language they speak at home, no matter if they come from a rural or small town, every single child at this hospital deserves not to be treated the same, but to be treated special as my boy, as special as your kids and family too. It's a reminder that for my family and for all of our families, health equity is personal. It's personal. So I'll ask again, who cares about equity? But maybe the question should be, do you care about equity? Or are you willing to surrender the effort on the journey to best outcomes to the fear that ensuring equity, fairness, and justice for our patients is just a little too hard? It's a little bit too much work. Well, I'm glad that there are others who are willing to take this stand with me. They work right here at Nationwide Children's. I want to introduce you to some of those people today. Every quarter, I have the privilege of doing walkarounds with our Protective Services Division. They're doing some incredible work. Most recently, some of the work that they're doing is helping to ensure improved interactions between law enforcement here locally and patients, families, and staff. Another exciting project that they have embarked upon is addressing workplace violence efforts, especially workplace violence at the hands of some of our most challenging patients. I remember I asked one of these officers to explain to me what their role has to do with equity. The answer I got was incredible. He said, Dr. Ray, if you as a healthcare provider are afraid to go into a patient's room because of violence that you might face when you enter there, you are naturally going to be less likely to want to go into that room and provide the necessary care for that vulnerable patient. That creates a bias that impacts negatively some of the most vulnerable patients in our community. He's right. He's right. When protective services officers care about health equity, they help to make our patients safer. Another great example, I have the privilege, like many of you in this room, of caring for kids from across our incredible community, including a lot of families in rural places in my new favorite neck of the woods, my Mansfield Close to Home clinic. And often I will hear conversations from some of my colleagues who will say, you know, Dr. Ray, I just met this incredible family. They're in my clinic for kidney care. They are a beautiful African-American family, and I just can't help but thinking that they might rather come to see you in clinic because, I don't know, maybe they will be able to relate to you a little bit better. And I appreciate where that question is coming from, but I have to remind my colleagues that I too look different from most of the patients that I see in my clinic. And rather than me sending all my white patients to my white colleagues, I actively seek opportunities to build connection and common identity with those individuals. What does that look like? Well, maybe it is your shared love of, say, a particular national championship sports team. Oh, wait! Or maybe it's your shared love of a certain movie or genre of music, a particular artist or book. Maybe it's your favorite subject in school. Maybe it's what they're wearing that day. Maybe it's your efforts to Greet them in their native language when you guys don't share very many words in common. These small efforts make a huge difference to improving the experience that our patients have, humanizing them, and helping us to achieve equity in our care environments. When diverse healthcare professionals care about health equity, it makes our care better. And you know what else? It's really awesome to see the beauty and cleanliness of our facilities. I love it. I know you all love it too. I go to children's hospitals all the time to give talks and lectures, and I'm gonna tell you right now, none of them look as pretty as Nationwide Children's. And it's our environmental service team that is key to the effort to keep our hospital beautiful and clean. But the work that they do goes way beyond just sweeping floors and wiping down surfaces. Our environmental service workers build deep and meaningful relationships with patients, families, and staff. Maybe some of you in this very room have deep and meaningful relationships with our partners in environmental services. I cannot tell you the number of times I have heard great stories about how environmental service staff have positively impacted the lives of patients and families who've been admitted here for days, weeks, in some cases months, and improved the experience and care that they have received at our hospital. I can also tell you the number of times where I've been on an elevator after a hard day at work, only to be sharing that elevator with an environmental service staff member who looks at me and says, "Keep your head up, Doc, I'm proud of you." Those interactions, those positive interactions from our workforce team members, no matter the role that we have, those interactions help to make our work in health equity more meaningful in our institution. So, I'll ask the question again. Do you care about health equity? Because I may be the Chief Diversity and Health Equity Officer at one of the 10 best children's hospitals in America. But when I bring my son to this hospital for surgery soon, I can do absolutely nothing to ensure his equitable outcome. I will be entirely reliant on each and every one of you to ensure that health equity matters to you as much as it matters to me. So, be encouraged today, and thank you for your attention.